Hi, my name is Melissa and today we're going to be inserting IV. So I'm going to go ahead and check my computer, check I'm having the right patient, checking for the right orders, going over the patient's chart. So I'm going to go ahead and gather my equipment, which I got my pair of gloves, my tubing, my fluid, which is normal saline, 250 ml, my IV starting kit, tape, needle, extension port, chuck, and my normal saline flush. So once I'm right here verifying my patient and the orders, I'm going to go ahead and verify I have the right fluid. I'm going to check for the expiration date, clarity on the fluid, make sure I have the right patient, right dose, which is 250. It's going to be IV route. The time the order is for 7 p.m. is 6:55 p.m. And I'm also going to make sure he doesn't have any contraindications or reasons why not to have an IV. So now that I have all my equipment, I'm going to go ahead and go to my patient's room. Knock, knock.
Hello.
Hi, my name's Melissa. I'm going to be your nurse today. Can I verify your ID band? Can you give me your full name and date of birth?
5/6/1968. Victor Martinez.
Alright, Mr. Martinez. So the doctor put an order for an IV. Have you had an IV done before?
Yes.
Okay, so you know how it usually goes with an IV?
Yes.
Have you ever had any complications with an IV?
No.
Okay, sounds good. So the reason why we're doing an IV is because your lab work came back with indications of dehydration. So we're going to go ahead and give you 250 ml of normal saline. So I'm going to go ahead and get my equipment ready. I'm going to wash my hands. I'm going to put my gloves on. Now that I have clean gloves, I'm going to go ahead and open all my packaging before I get started. So I'm going to go ahead and also put my fluid bags. So I'm going to be using a white port. I'm going to make sure I keep all caps of my port as of right now on to keep it sterile. I'm going to make sure I close all the caps on my port. Alright, so now that I make sure I have all my caps closed, I'm going to remove the cap of the end of my tubing that is going to go into my bag. Remove the end of my fluid. Remove the cap from the end of my fluid. Insert the tip. Once I have that, I'm going to go ahead and flip it over and prime my chamber, fill it up halfway. Once I got that, I'm going to make sure I go ahead and prime my entire line. Make sure there's no air bubbles. Alright, now that I have that, I'm going to go ahead and hang that in the pole next to my pump. I'll leave that there. I'm going to go ahead and prep my extension tube. Keep the end to it to keep it sterile, just loosen it up just a little bit. So now that I have all that ready, I'm gonna go ahead and take off my gloves, dispose of them in the trash. I'm gonna go ahead and wash my hands. Sir, is there any reason why I can't do an IV on this hand?
No.
No? Okay, I'm going to go ahead and look for a vein. Let me go ahead and apply my tourniquet. Apply my tourniquet. I'm going to assess my vein. Okay, there's a good one right here. Now that I found it, I'm going to go ahead and remove my tourniquet for now. Wash my hands again. Get a new set of clean gloves. Once I have a clean set of gloves, I'm going to go ahead and put a chuck underneath just in case of any blood, spill, or fluid. Don't want it on my patient. I'm going to go ahead and apply the tourniquet on again. While I'm at it, I'm going to go ahead and prep my tape as well. I'm going to go ahead and also clean my IV side with some alcohol. Go ahead and clean. Now that I'm all ready, I'm going to go ahead and grab my needle. Make sure I have the right appropriate size of my needle. Go ahead and remove the cap. Inspect my needle and my catheter. Make sure it's all right. So sir, it's going to be just a small poke, all right? So I'm going to grab him underneath the arm, pull any skin. On the count of 3, sir. 1, 2, 3. Insert my needle. Make sure I have a flashback return, and then advance my catheter. Once I advance my catheter and I get a flash return, I'm going to go ahead and occlude, remove the needle, and put it dispose of it, release the tourniquet. I'm going to go ahead and connect my extension set. And then once I've connected my extension set, I'm going to go ahead and see if I get any blood return with the syringe and flush for an easy flow. Now that my IV is good, I'm going to go ahead and secure it. I'm going to put tape for right now, but I would usually be putting a Tegaderm over here. The Tegaderm there. I'm going to go ahead and loop the rest of my extension set and tape it as well. Now that my IV site is secure, I'm going to go ahead and connect it to the fluids. Remove the port, make sure I keep it sterile. Connect it to the extension set. And put the infusion rate that the order was in. Make sure it's flowing correct. I'm going to go ahead and inspect it for any swellingness, redness. Sir, if you start feeling coolness or if it's hurting, burning at the site, please let me know. Now that I'm done, I'm going to go ahead and write my initials, time the IV was done and inserted, tape it, put it near the dressing. I'm going to go ahead and remove my gloves, dispose it in the trash, make sure my sharp is in a sharp container and all my trash is in a trash bag. I'm going to go ahead and document where the IV was inserted, which is the right AC at 7 p.m. and no complications, and the site looks good, no signs of infection or infiltration. Sir, I'm going to come back and reassess you, see if you're doing okay. I'll come back and document anything else that I've forgotten. Sir, how are you doing right now?
I'm doing good.
Any pain, burning?
No.
No? Okay, I'm going to make sure reassess the area again. That way, whenever someone else or your next nurse knows about your IV site, and she can recheck it to see if there's any complications for your IV. And that's it.